Hello, and welcome to my presentation on humanistic therapy. My name is Alex Burgess. I hope you enjoy my presentation. I look forward to any questions or comments. A quote by one of our founders of humanistic therapy, by Carl Rogers. The good life is a process, not a state of being. It is a direction, not a destination. So a brief introduction as to what humanistic therapy is, and we must look also at its roots. So humanistic therapy is a mental health approach that emphasizes the importance of being your true self in order to lead the most fulfilling life. It is based on the principle that everyone has their own unique way of looking at the world. In order to understand what humanistic therapy is, we must know its origins. The foundation of humanistic therapy is the psychological theory of humanism. It is an outlook or system of thought attaching prime importance to human rather than divine supernatural matters. Humanists believe stress the potential value and goodness of human beings, emphasize common human needs, and seek slowly rational ways of solving human problems. We will learn later on the presentation the different types of humanistic therapy as well. There are some key people in the foundation of humanistic therapy and humanism, the theory itself. Some of these key members are the force of three. They're the founders of the humanistic psychology who developed and paved the path to humanistic therapy. Each of the new psychologists gave force to what we call today humanistic therapy. Maslow, being the father of humanism, proposed the philosophies of humanism and existentialism, as well as the foundation of all as a hierarchy of needs. A person cannot reach their need next until their next level of need without the first being met, and so on and so on. Carl Rogers was a humanistic psychologist who is one of the founding members of the humanistic approach and what we refer to as today as a client-centered approach in therapy. James Budendell, also known as the Third Force, was a prominent catalyst in the approach of humanistic therapy movement. He was a therapist, a teacher, and a writer for over 50 years. On this slide, we'll look a little bit into the history of humanistic therapy. Humanistic therapy originated in the 1950s. Abraham Maslow and Carl Rogers developed humanistic therapy as a criticism of psychoanalytical therapy and behaviorism. James Budendell championed the importance of the individual. Maslow first created the hierarchy of human needs, a motivational theory in which states humans have psychological needs, safety needs, belongingness and love needs, esteem needs, and self-actualization. Rogers established a client-centered approach. Their theories combined and led to what we now call humanistic therapy. As James Budendell championed the importance of the individual and felt that our journey towards authenticity was the most profound and healthiest things we could hope and achieve in life. So we ask ourselves, what is the humanistic approach to humanistic therapy? It is humanism. Humanism is the importance of human potential. Rather, a few techniques utilized with humanistic therapy are empathy, understanding of the client's point of view, self-actualization, the point in which an individual reaches their fullest potential, authenticity. A therapist is present with the client and engaged with their client. It is a system emphasizing the importance of human potential. All humans have the potential of goodness and to lead productive, fulfilling lives. Humanistic therapy applies the concepts of humanism for problem solving. There are a few types of human therapy that are utilized to meet the client's needs and are based on the value of human worth and goodness. These are client-centered therapy, the Gestalt therapy, and narrative therapy. So as we look and think of what is a goal, I mean, as a client, when I'm seeing my therapist or vice versa as a therapist seeing my client, what approach and what style of therapy do I want to utilize in order to meet the goal, and what is it the goal that we're trying to meet with our client? The humanistic therapy goal is an empathetic understanding of the client's frame of reference or subject experience. We respect the client and then their exploration of problems through an authentic and collaborative approach, allowing the client to develop the insight and courage and responsibility. So as a humanistic therapy, I would seek to help my clients cultivate a healthy and sense of self-worth. And hence the client then develops a positive view of themselves and in turn others within their life as well too. They find meaning in their lives and confidence to make the beneficial choices that drive their thoughts and behaviors, leading them to self-actualization. So as an individual and student myself, I would stop and think, what does this type of therapy treat? The humanistic therapy is used to treat depression, anxiety, panic disorders, personality disorders, schizophrenia, addiction, and relationship issues, including family relationships. It is beneficial for several mental health disorders. Aside from diagnosable mental disorders, humanistic therapy applies to numerous life situations as well. In this slide, we discuss the pros and cons of humanistic therapy. As with anything, there are both pros and cons. The benefits of humanistic therapy is the non-judgmental environment. Clients are more inclined to share emotions and struggles. Humanistic therapy is beneficial for several mental health disorders. This includes depression, anxiety, panic disorder, schizophrenia, and substance abuse, such as alcoholism. And it offers, aside from a diagnosable mental disorder, humanistic therapy applies to numerous life situations. But as with anything, there's also risks involved. There are many that argue that the humanistic therapy is not optimal for serious, complex mental disorders because clients may struggle dominating the therapy session as it is client-centered when not in touch with their reality. In conclusion, a humanistic therapist is usually trained to be a warm, empathetic, understanding, and non-judgmental person. An open client-therapist relationship can provide benefits for those dealing with depression, anxiety, addictions, personality disorders, low self-esteem, and relationship issues. It is because it's a form of positive psychology. Humanism emphasizes the positive side of the human nature and assumes all people want to live fulfilling lives. I thank you for viewing my presentation. I apologize for the shakiness of my voice. I always get a little nervous. I do look forward to your comments and learning from each and every one of you. I've enjoyed this class with all of you. I thank you and have a wonderful evening.